A lot of people have been asking me about how they identify low testosterone levels, both men and women. Going to me for bioidentical hormone replacement. Far and away, the most prominent symptom I see or complaint I get from women is that they have just a decreased libido. Although they will also notice decrease in muscle mass and increase in visceral fat mass as well. Men, it's much more diffuse and diverse in terms of the symptomatology. Number one, they come in saying they just feel terrible, or they just feel like crap. And here's what they mean by that. First of all, they feel fatigued. They don't have near the energy they once had. Their motivation drops. Many don't want to get out of bed in the morning. They feel depressed, down. Their libido drops, and also lean muscle mass starts to decrease, and visceral fat mass, especially around the middle, starts to increase. So what are some natural ways you can counter that? Well, number one, exercise. Vigorous exercise will boost testosterone levels, as will eating 1 to 1.5 grams per pound of body weight a day, which is a lot, but you want to spread that out over 4 to 5 meals a day. That will naturally boost testosterone. Other ways to boost it without actually going to testosterone replacement therapy are things like HCG, human chorionic gonadotropin, 3,000 units a couple times a week if your levels do end up being low on lab tests, as well as clomiphene, 25 milligrams every other day. I had a gentleman I treated recently who was pretty low in terms of his total and free testosterone, and just by using some clomiphene, 25 milligrams every other day, his total testosterone went up over 1,000, and his free testosterone was well into the 20s. So it did a fantastic job. Of course, we have testosterone replacement therapy, which in women we can replace by creams. Sublingual troches are the most common. Very select group sometimes will wind up opting for subcutaneous injections. In males, we have obviously intramuscular injections, subcutaneous injections, gels, creams, troches under the tongue, and of course everybody's heard of pellet therapy, but I'm not a fan at all. Pellet therapy is dependent upon cardiac output or blood flow. So most people are told that their pellets will last 4 months, when in fact, if they're in to vigorous physical activity, if they start a new exercise program in which they're much more vigorous, sometimes a couple training sessions a day, as well as using an infrared sauna, steam room, or hot tub, they're going to burn through their pellets much more quickly, sometimes within a month. So I'm not a fan of pellet therapy at all. I think there's just better ways and more consistent ways to keep your testosterone levels at a peak level in a sustained manner. Be well.